This video is a continuation of the functional nuclei and the component of the cranial nerves. In the last video, we have seen about the motor nuclei. Now we are going to see about the sensory nuclei. So first we'll see the general and the special visceral afferent nuclei. The general and the special visceral afferent nuclei are represented by one nucleus, that is the nucleus tractus solitarius or the solitary tract nucleus. So this is the nucleus tractus solitarius. In the upper part, the nucleus lie deep in the reticular formation ventrolateral to the dorsal nucleus of the vagus. When traced downward, it lies in the dorsal part of the central gray matter in the close part of the medulla, dorsomedial to the dorsal nucleus of the vagus. So this is the dorsal nucleus of the vagus. So in the upper part it lies ventrolateral, in the lower part it lies dorsomedial to the dorsal nucleus of the vagus. The lower end of the nuclei of both sides, so here also you will have, so the lower end of the nuclei of both sides, they fuse to form a commissural nucleus of the vagus. So this forms a commissural nucleus of the vagus. So this is a diagrammatic representation. So here you can see the nucleus of the tractus solitarius. The lower end is connected by the commissural nucleus of the vagus nerve. Now you can see the rostral part. So the rostral portion of the nucleus is concerned with the taste sensation and it receives the special visceral afferent fibers from the facial, glossopharyngeal and the vagus nerve. So the facial, glossopharyngeal and the vagus nerve. And it is referred frequently as the gustatory nucleus. The rostral part of the nucleus of the tractus solitarius is also known as the gustatory nucleus, and it receives the special visceral afferent fibers from the facial, glossopharyngeal and the vagus nerve. The nuclear termination of the 7th, 9th and the 10th nerves are in the rostrocaudal direction. The caudal portion of the nucleus receives the general visceral sensation from the pharynx via the glossopharyngeal and the vagus nerve and from the esophagus and the abdominal part of the GIT up to the right 2/3 of the transverse colon via the vagus nerve. The axons from the nucleus of the tractus solitarius, they project to the thalamus and the hypothalamus of the opposite side through the solitariothalamic and the solitario-hypothalamic tracts respectively. So these tracts join the medial lemniscus on its way to the opposite side thalamus and hypothalamus. The neurons of the thalamus then they project to the cerebral cortex. Next we'll see about the general somatic afferent nuclei. The general somatic afferent nuclei include the three sensory nuclei of the trigeminal nerve. The first one is the chief or the principal sensory nucleus of the trigeminal nerve. Then you have the spinal nucleus of the trigeminal nerve and its tract, and then you have the mesencephalic nucleus of the trigeminal nerve. So these are the three sensory nuclei of the trigeminal nerve. This is a diagrammatic representation. Here you can see this is the chief sensory nucleus of the trigeminal nerve and this is the spinal nucleus of the trigeminal nerve and this is the mesencephalic nucleus of the trigeminal nerve. The chief sensory nucleus of the trigeminal nerve, it lies in the dorsolateral part of the tegmentum of the upper part of the pons lateral to the motor nucleus of the trigeminal nerve, and it occupies an intermediate position between the mesencephalic nucleus above and the spinal nucleus below. It is concerned with the tactile sensibility. This is the transverse section of the upper part of the pons, and here you can see this is the main sensory nucleus of the trigeminal nerve. So this nerve lies lateral to the motor nucleus of the trigeminal nerve. So this is the motor nucleus and this is the main sensory nucleus. So it lies lateral to the motor nucleus of the trigeminal nerve. Next we'll see about the spinal nucleus of the trigeminal nerve. The spinal nucleus of the trigeminal nerve extends caudally from the chief sensory nucleus in the pons to the second cervical spinal segment, and it lies just medial to the spinal tract of the trigeminal nerve. The spinal nucleus and the tract of the trigeminal nerve are chiefly concerned with the pain and the temperature sensation. Based on the cytoarchitecture, the spinal nucleus is divided into 3 parts or subnuclei in a craniocaudal direction. They are the pars rostralis, then you have the pars interpolaris, then you have the pars caudalis. The main afferents of the chief sensory and the spinal nuclei or the central processes of the cells in the trigeminal ganglion. So the central process, they make up the sensory root. So after entering the pons, many of these branches, they divide into ascending and descending branches. Some of them either they ascend or descend. The ascending branch, they end in the chief sensory nucleus, and the descending branches, they form a large bundle of fibers called the spinal tract of trigeminal nerve. The fibers of the spinal tract, they terminate into the subjacent spinal nucleus. The afferents from the 3 trigeminal division, they rotate so that the fibers of the ophthalmic division terminate in the pars caudalis. The fibers of maxillary division, they terminate in the pars interpolaris, and the fibers of mandibular division in the pars rostralis. The fibers ending in the chief sensory nucleus are predominantly concerned with the touch, and those ending in the spinal nucleus are concerned predominantly with the sensation of pain and temperature. So it is important to note, in addition to the trigeminal nerve, the spinal tract, they receive a small component of fibers from the 7th, 9th and 10th cranial nerve, which carry the general somatic sensation from the external ear, the mucosa of the posterior third of the tongue, the pharynx and the larynx. Fibers arising from the cells of the chief sensory and the spinal nuclei of the trigeminal nerve are the second order neurons. So they cross to the opposite side and they form a bundle called as ventral trigeminal lemniscus, which ascends up and they relay in the thalamus in the ventral posteromedial nucleus of the thalamus, and from here this forms the third order sensory neuron. So from here they are projected into the sensory area of the cerebral cortex. So here the trigeminal ganglion, the cells in the trigeminal ganglion forms the first order sensory neuron. The cells of the chief sensory and the spinal nucleus of the trigeminal nerve, they form the second order sensory neuron, and the nuclei present in the thalamus, they form the third order of sensory neurons. Next we'll see about the mesencephalic nucleus of the trigeminal nerve. The mesencephalic nucleus of the trigeminal nerve extends from the upper end of the chief sensory nucleus in the pons to the midbrain, where it lies in the central grey matter lateral to the cerebral aqueduct. Because it extends rostrally into the midbrain, it is called as the mesencephalic nucleus. Like the dorsal root ganglia of the spinal cord, it is made up of pseudo-unipolar cells. These cells, they form the first order sensory neurons and they appear to have the similar function. The mesencephalic nucleus is unique in the sense that it is the only site in the central nervous system which contain the cell bodies of the first order sensory neuron. The peripheral process, they carry the proprioceptive impulses from the muscles of the mastication, temporomandibular joint, teeth, and possibly from the extrinsic muscles of the tongue. The central processes, they terminate in the motor nucleus of the trigeminal nerve of both sides. These connections establish a stretch reflex originating in the neuromuscular spindle in the muscles of the mastication together with the reflex for the control of the force and accuracy of the bite. These reflexes, they prevent the tongue being bitten during chewing. The other central processes, they relay in the cells of the reticular formation from which the fibers arise and they run through the dorsal trigeminal lemniscus. And these cells, they relay in the ventral posteromedial nucleus of the thalamus and this forms the second order sensory neuron. So out of the three sensory nuclei of the trigeminal nerve, the chief sensory nucleus is mainly responsible for the sense of touch, the spinal nucleus for the sense of pain and temperature, and the mesencephalic nucleus for the sense of proprioception. Next we'll see about the special somatic afferent nuclei. So first we'll see the cochlear nuclei. So these are the cochlear nuclei. They are two in number. One is the dorsal and the ventral, and they are placed on the dorsal and the ventral aspects of the inferior cerebellar peduncle in the upper part of the medulla oblongata. The cochlear nuclei, they contain the cell body of the second order sensory neuron in the auditory pathway. So we have seen the connections of the cochlear and the vestibular nuclei in the 8th cranial nerve. Next we'll see about the vestibular nuclei. So it is situated partly in the medulla and partly in the pons, immediately beneath the lateral part of the floor of the fourth ventricle. So this area of the fourth ventricle, floor of the fourth ventricle is called the vestibular area. On the basis of the cytoarchitecture, the afferent and the efferent connections, there are 4 distinct nuclei are present. So one is the inferior nucleus, the inferior nucleus or the spinal nucleus, and then you have the lateral nucleus. This nucleus is also called as the diatus nucleus, and then you have the superior vestibular nucleus, and then you have the medial vestibular nucleus. The inferior vestibular nucleus, they lie in the medulla just medial to the inferior cerebellar peduncle. It is continuous rostrally with the lateral vestibular nucleus and it is related medially to the medial vestibular nucleus. It extends from the cranial end of the nucleus gracilis to the pontomedullary junction. The lateral vestibular nucleus, they lie immediately cranial to the inferior vestibular nucleus and they extend upward in the pons almost to the level of the nucleus of the abducens nerve. It is composed of large multipolar cells resembling the typical motor neurons, and the cells of this nucleus gives origin to the fibers of the lateral vestibulospinal tract. The superior vestibular nucleus is smaller in size. They are located within the pons just above the medial and lateral vestibular nuclei. Then you have the medial vestibular nucleus. It extends from the medulla at the level of the olive to the lower part of the pons. It is bounded laterally and rostrally by the other three vestibular nuclei. Its medial border is near the midline of the brainstem. The caudal end of this nucleus is near the caudal limit of the fourth ventricle. Now we'll see the nuclei, the functional component and the distribution of the individual cranial nerve. So first we'll see the first cranial nerve, the olfactory nerve, the nerve of Smith. The fibers of this nerve are classified as the special somatic afferent. They carry the sense of smell from the olfactory epithelium of the nose, which is derived from the ectoderm. So we'll see in detail later. So the component of the olfactory nerve are the special somatic afferent fibers. Next we'll see about the second cranial nerve, the optic nerve or the nerve of the vision. The optic nerve fibers are also recorded as the special somatic afferent fibers. The retina develops from the optic vesicle of the forebrain and they contain the two types of receptors for the light, namely the rods and the cones. The visual impulses from these receptors, they run through the bipolar cells to the ganglion cells. The axons of the ganglion cells, they converge towards the optic disc and they pierce the choroid and sclera to leave the eyeball and they form the optic nerve. The unique feature of the optic nerves are it is not a peripheral nerve but a tract, a prolongation of the white matter of the brain, as the optic nerve develops from the stalk of the optic vesicle. And it is covered by the three meninges of the brain, the pia mater, arachnoid matter and dura mater. It is devoid of neurilemmal sheath and its fibers are myelinated by the oligodendrocytes. When you see the clinical correlation, the optic nerve, if damaged, cannot regenerate because its constituent fibers are devoid of neurilemmal sheath. We have seen in detail about the optic nerve and the pathway in detail. Kindly refer to the playlist of the cranial nerves. Next we'll see about the oculomotor nerve. When you see the functional components of the oculomotor nerve, so first you have the general somatic efferent fibers. These fibers, they arise from the main oculomotor nucleus and they supply all the extrinsic muscles of the eyeball, including the levator palpebrae superioris, except the lateral rectus and the superior oblique muscle. These fibers, they form the main component of the oculomotor nerve. Then you have this general visceral efferent fibers. So these fibers arise from the Edinger-Westphal nucleus and they pass through the oculomotor nerve and to terminate in the ciliary ganglion, and these are the preganglionic parasympathetic fibers. The postganglionic fibers from the ciliary ganglion, they run through the short ciliary nerve and they supply the sphincter pupillae and the dilator pupillary muscles. Kindly refer to the cranial nerve playlist for the detailed description, course and everything about the oculomotor nerve. When you see the clinical correlation in the oculomotor nerve palsy, the eye is fixed in lateral and downward position, that is a lateral squint or strabismus, due to the unopposed action of the lateral rectus and the superior oblique muscle. The pupil is dilated due to the unopposed action of the dilator pupillae, which is supplied by the sympathetic fibers accompanying the nasociliary branch of the ophthalmic nerve. and the upper eyelid droops down or ptosis due to the paralysis of the levator palpebrae superioris muscle. Next we'll see about the trochlear nerve, the fourth cranial nerve. When the functional component of the trochlear nerve are the general somatic efferent fibers which arise from the trochlear nucleus, and they supply only one muscle, that is the superior oblique muscle. When you see the clinical correlation, the superior oblique is the only depressor of the eyeball during adduction. Therefore, in the trochlear nerve palsy, the eye is extorted and elevated due to the unopposed action of the inferior oblique muscle. The vertical diplopia occurs in this position as the image falls on the upper half of the retina. The diplopia worsens when the patients look down when the eye is adducted. Next we'll see about the fifth cranial nerve, the trigeminal nerve. This has the following functional components. So the first one is the special visceral efferent fibers arising from the motor nucleus, and they supply the muscles derived from the first pharyngeal arch mesoderm, namely the muscles of mastication, the tensor tympani muscle, the tensor palatine muscle, and the anterior belly of digastric muscle and mylohyoid muscle. Then you have the general somatic afferent fibers, and they are divided into two groups. The fibers carrying the exteroceptive sensation from the skin of the face and the mucous membrane of the mouth and the nose, and the cell body of these neurons lie in the trigeminal ganglion, and most of the central processes of these neurons, they bifurcate. The ascending branches terminate into the chief sensory nucleus, whereas the descending branches, they end in the spinal nucleus. The fibers carrying the proprioceptive sensation from the muscles of mastication, temporomandibular joint, teeth and tongue. The cell bodies of these neurons, they lie in the mesencephalic nucleus. The peripheral processes of the nerve cells are located in the trigeminal ganglion, and the mesencephalic nucleus are arranged as three divisions of the trigeminal nerve: the ophthalmic, the maxillary and the mandibular nerve. When you see the clinical correlation, first we'll see the lesion of the trigeminal nerve. It presents with the loss of general sensation from the face and the mucous membrane of the oral and the nasal cavity. Then you have loss of corneal reflex. Then you have the flaccid paralysis of the muscles of mastication, and the jaw deviates to the side of the lesion due to the unopposed action of the lateral pterygoid muscle. Then you have the hypoacusis, that is the partial deafness to low pitched sound due to the paralysis of tensor tympani muscle. Then the trigeminal neuralgia or tic douloureux. It is a paroxysmal severe pain of sudden onset and short duration in the area of cutaneous distribution of one or more of the divisions of the trigeminal nerve, usually affecting the second and the third divisions. Next we'll see about the sixth cranial nerve, the abducer nerve. The functional component of the abducer nerve are the general somatic efferent fibers arising from the abducer nucleus, and they supply only the lateral rectus muscle. When you see the clinical correlation, the abducer nerve palsy is the most common isolated palsy occurring due to the increased intracranial pressure. The abducer nerve lesion causing the paralysis of the lateral rectus muscle result in the medial or convergent squint or strabismus. The eyeball is fixed in the medial position due to the unopposed action of the medial rectus muscle. The horizontal diplopia occurs, which increases when the patient attempts to look towards the paralyzed side. In the next video, we'll see the functional component and the distribution of the next 6 cranial nerves. Kindly refer the playlist of the cranial nerves for the detailed description of all the cranial nerves.